Good afternoon. I will be hosting the press conference this afternoon. As you know, this thing is going fast and furious, and Judge Jenkins has been working all morning and has got a couple of things to do. I think this will be real brief. Majority of the information will come from David Lakey. I'll fill in some of the blanks, and then Jennifer Gates will give us an update on what's happening at the apartment complex themselves. Obviously, David Daigle is here from the CDC if there are any specific questions. Let's start with Mr. Lakey.
Yes, sir. Well, good afternoon, everyone. My name is David Lakey. I'm the Commissioner of Health for the state of Texas, and I thank you for being here today. Obviously, there's a lot of folks here in Dallas that are working very hard to make sure that we address this issue fully. A lot of people are scared. A lot of people throughout Dallas are scared right now. But I want to let you know that we're working really hard to make sure no other Texans are exposed to this virus. The work that we're doing includes making sure that good infection control is taking place in the hospital right now. Caring for this individual, I was up in the ward. They're doing a great job giving compassionate care to this individual, making sure that they do what they need to do to make sure that their hospital staff are safe while they provide that compassionate care. At the same time that care is being provided, a lot of work is taking place with a team of epidemiologists consisting of folks from the CDC, folks that are my employees from the Texas Department of State Health Services, and individuals that are employed by the Dallas County Health Department. They're working as a team to make sure that every individual that had contact with the initial case have been identified. 100% of the individuals have been identified. We have 48 individuals that we are watching closely. 10 of those individuals had higher risk, and again, all of those individuals are being seen once a day and having their fever checked twice a day. 100% were seen yesterday. 100% of them had no signs of fever, had no signs of illness. 100% were doing well. And so we continue to watch them very closely. Besides the monitoring that takes place, when the epidemiologists go and see them, if they identify that there's any needs that they need, such as food, or there were some individuals where we had a large storm here and the storm took out the electricity, we moved up them on the restoration of power so we could get their electricity back on. And so we're trying to make sure that we provide them compassionate services while we're doing this, and in the midst of this very stressful situation for them, that we do it and provide them the services that we need. Now, I know this is scary, but I want to reiterate the science behind it. And Dr. Frieden has done a good job, I think, emphasizing these basic points about this virus. Well, first, this isn't West Africa. This is a very modern city. We don't have the level of poverty that they have in West Africa that is very conducive to the spread of the disease. They don't have the teams of epidemiologists that we have monitoring every single person on a daily basis. They don't have the modern healthcare system that we have here in the United States. Some of the things that we take for granted, when we go into the hospital, individuals being in a single room, having the gloves and gowns and the things that you need to use to keep the spread from infectious disease, that they don't have those things, but we're using those things. We have tried and true processes, protocols to stop the spread of infectious diseases. That's what public health does all the time for different types of infectious diseases, and we're using those tried and true processes and protocols. And again, from every information that we have right now, that seems to be working. 100% of people that we've evaluated, 100% that do not have fever. And so we need your help in the media to continue the education to individuals, because the concern right now is that the stress of this and the fear of this could be more damaging to this community than the virus itself. We have hospitals very good hospitals, very good emergency rooms in Dallas. All of those are providing compassionate, safe care. I would go and take my family to any emergency room here in Dallas, knowing the kind of care that is provided here in Dallas. We will continue that hard work in making sure that we meticulously follow individuals, make sure they're analyzed. We're trying to be as open as we can, as open as we can be about any of the facts and what's going on, and we'll continue to do that. How confident am I that this virus is not spread before individuals are having symptoms? I'm confident enough that I shook somebody's hand, yesterday. Went out and saw somebody, shook their hand. I'm confident enough that when I was with the judge, we talked about the judge, going out and visiting a family. We talked about that, and I felt confident enough to advise him that that's okay. All the science says that that's okay. You're not going to get the virus from being next to somebody that is not having any of the symptoms, not having any fever. You're not going to get the virus. And so we'll continue in our monitoring. We'll continue to watch this closely. We'll continue to have events like this and share information. I'm sure you know that we've had a large number of phone conferences with Dr. Frieden and myself, trying to be as transparent as possible about what's going on, and we'll continue to do that. And then finally, again, I want to thank the leadership of Dallas, Mayor Rawlings, Judge Jenkins, for their superb leadership in the midst of this. And as we were talking yesterday, this is really a one effort, one fight, one team, as we ensure that other Texans are not exposed to this virus. And with that, Mayor Rawlings, I think I'm done. Thank you.
Thank you very much. Just to fill in a couple of other blanks, we have, no problem. As of noon, we have finished phase 2 of the cleanup of the Mr. Duncan's apartment. We have destroyed his personal items. They were destroyed over the weekend. A drum is being taken away with all the other cleanup of the apartment itself. We have saved personal items like the grandmother's Bible, photos, hard drives, passports. Those things have been taken away. But as of noon today, that apartment is completely cleaned up. We have been meeting with Louise and the family and taking care of her needs every day. We got the basketball to the boy, and he said he liked football, so we got him a football, and so he's going to be able to throw that out there. And I think he was rooting for the Cowboys, so that was a natural thing to do. We also, over the weekend and this morning, we're in touch with her pastor, George Mason of the Wilshire Baptist Church. George is 25 years at that church, a real leader in the city. And George and Judge Jenkins met with the family this morning to make sure if there were any issues that we took care of them. And it was great. Pastor Mason has been on the phone with her and really counseling her. As you can imagine, she's been bombarded by a lot of different folks, and so that was a very good meeting. I hope we all don't jump on Pastor Mason now. Let him do his professional work as well. The great news for me is, remember, we take these temperatures 2 times every day. And we've got 0 symptoms, out there. 0. And that is a good sign. We are going to be having our fingers crossed and our hands folded in prayer for this next week. It's an important week, but the first signs are there. The ISD has not taken attendance yet because this storm is still a struggle with a lot of neighbors and in many of the schools. So we don't have a final number there for you. And let's see if I've got... I just think I'm very pleased at what took on this, what happened in Dallas this weekend, the amount of people that were out. This is an all-time opening for the the Texas State Fair, and those of you that are not in the city of Dallas probably don't realize how big that is, and you would feel something if there was some concern there. 92,000 people at the Cowboy game this weekend, so people are coming out and people are experiencing. Now, our concern is with the neighbors now. We've got the folks that are contacts. We now have to focus the neighborhoods and that apartment complex and that area. And Jennifer Gates has been out there. She's going to give you a little report on that in a way that citizens can help. Ms. Gates.
Thank you, Mr. Mayor, and thank you for your leadership. I'm speaking kind of as the voice for the Vickery Meadow neighborhood that I represent. This morning I met with over 30 leaders in the community. Half were faith-based, half were community nonprofits, and even a few of the retail representatives in the area. We also had representatives from DISD. Mike Miles was there. And then we had the CDC was present to answer questions for this community. Our goal was to assess the needs of that neighborhood. We met at North Park Presbyterian Church. The concerns of the community really are that they are the epicenter of this crisis, and it is, and they're afraid of the possible stigma that may result from that. And the best way to address this misconception is by us disseminating the information of how Ebola is spread, like you heard earlier. These residents, unless they happen to be one of those that were exposed that are being traced, they are not at risk for getting the disease, and they are not at risk for transmitting the disease. And unfortunately, they are feeling discriminated against. We still have some that have been turned away from jobs, some that have been turned away at retail locations. So we're getting them in touch with legal aid and any resources necessary. But we also feel like really it's about you as the public spreading the word of how this is spread and relieving the misconception and that this community is healthy. It's very reassuring to see the faith community standing in solidarity with the Vickery Meadow community to ensure that everyone is treated with dignity and respect. And this group is going to be working with the Community Foundation on how to spread the information effectively. As I've mentioned earlier, there's several languages spoken in Vickery Meadow, approximately 40, if you include all the dialects. In the apartment complex of the Ivy, 7 or 8. So these church-based organizations are helping us get the resources and DISD on how to have all the materials translated so we can effectively communicate. If you want to donate directly, the Communities Foundation, which is cftexas.org, has a location on their website that they are taking donations, and then they will find out whatever the need may be that they'll be able to contribute to. There's also 4 or 5 very strong nonprofits in the area. The Vickery Meadow Learning Center, the Vickery Meadow Youth Foundation, Healing Hands, the Vickery Meadow Food Pantry, and Heart House. This community will be sending out detailed information how you can help directly with those organizations. But they're in place. They're already meeting the needs of this community. The food pantry is taking in food. This is to meet the needs, I'll reiterate, meet the needs of the community, not the needs of those necessarily that the health department is tracking and they're working with to make sure their needs are met. But this is a vulnerable community that could use all the help they could get, and especially so any of these wonderful organizations that have been active there, you can get in touch with them directly too. If you want to volunteer in the area, the North Park Presbyterian Church, Ellen Mata is a coordinator, and she can be reached at 214-460-5732. And we will then get we're finding some volunteers. Some of the nonprofits in the area are finding their volunteers are afraid to come into the neighborhood, so they're trying to recruit more volunteers. If you're willing to volunteer, we can get you in touch with the correct people through North Park Presbyterian. They've made the PID in the area, who puts on the National Night Out, has made a decision because of all the resources being directed to help the neighborhood directly, the security concerns, that they are not going to hold the National Night Out. We're going to postpone it for a few more weeks since we're focusing on these direct needs time. It's not because we're afraid of spreading Ebola, but it's just that the resources need to be directed in another fashion. That National Night Out usually has about 500 people, and there's a lot of coordination efforts. And those coordination efforts right now are just being able to meet the other needs. So we're going to postpone that, and we're going to have a bigger and better National Night Out when this media frenzy dies down. But our response as a community really can be a model. And Vickery Meadow is an incredibly culturally diverse, wonderful neighborhood. And it's warming my heart that people are being compassionate and getting together to meet the needs of these residents. They're resilient, and and my hope is that at the end of this, that they will be lifted up and we'll have even a stronger community. So thank you for your cooperation.
In closing, Dallas is strong. It is strong because of the nature of the people, but also because of the support we've gotten throughout this nation. I've gotten many calls from people all across. I just got off the phone with Reverend Jackson, who says anything we can do to help, we will. So there are people that are rooting us on and here to support us. Believe it or not, there are mean people from time to time that this comes out. And these mean people that are spreading falsehoods is not acceptable for me. And tell anybody that believes what we're saying is not true to call me, and we'll talk about it.